Hi everyone, welcome back to my YouTube channel and today we are going to talk about temporal fossa. So let's start our topic with introduction. Temporal fossa is a shallow depression that is located on the lateral side of the skull. It serves as an important anatomical region because it accommodates the temporalis muscle, that is a key muscle involved in chewing. This fossa is formed by several cranial bones and is bounded by distinct anatomical landmarks. Understanding its structure and content is essential in anatomy, dentistry, and clinical medicine. Location of temporal fossa. Temporal fossa is situated on the lateral aspect of skull, above the zygomatic arch and below the temporal lines. It is continuous inferiorly with infratemporal fossa, that is a deeper space beneath it. Boundaries of temporal fossa include superior and posterior boundary, anterior boundary, inferior boundary, medial boundary or floor, and lateral boundary or roof. First, talking about superior and posterior boundary. It is formed by superior temporal line, that is an arching ridge on the parietal bone and frontal bone. Second boundary is anterior boundary, that is formed by frontal process of zygomatic bone and zygomatic process of frontal bone. Third boundary is inferior boundary, that is formed by zygomatic arch which separates it from the infratemporal fossa. Fourth boundary is medial boundary, that is also called as floor. It is composed of parts of frontal bone, parietal bone, temporal bone and sphenoid bone. Next boundary is lateral boundary, that is also called as roof. It is covered by temporal fascia, that is a strong fibrous sheath attached superiorly to superior temporal line and inferiorly to the zygomatic arch. Contents of temporal fossa include temporalis muscle, deep temporal nerves, deep temporal arteries and veins, middle temporal artery and temporal fascia. Temporalis muscle is a broad, fan-shaped muscle that is responsible for elevating and retracting the mandible. Deep temporal nerves are branches of mandibular division of trigeminal nerve which innervate the temporalis muscle. Deep temporal arteries and veins are branches of maxillary artery and vein that supply the temporalis muscle. Middle temporal artery is a branch of superficial temporal artery. Temporal fascia is covering the temporalis muscle that provide protection and structural support. Functions of temporal fossa. First is muscle accommodation, as this fossa provides space for temporalis muscle which plays a vital role in mastication. Second function is pathway for neurovascular structure, as this fossa allow passage of nerves and vessels that supply the temporalis muscle. Third function is structural division, as this fossa form an anatomical landmark that separates the temporal region from the infratemporal fossa. Clinical significance of temporal fossa. If there are any fractural infection in this area, they can affect chewing and they may spread to deeper cranial spaces. Conclusion of this lecture video. Temporal fossa is a shallow depression on the side of skull that houses the temporalis muscle and important neurovascular structures. It is bounded by temporal lines, zygomatic arch, and cranial bones, and it also plays a central role in mastication and clinical anatomy. Its continuity with infratemporal fossa make it an important anatomical region for surgeons, dentists, and clinicians. And this was all about temporal fossa. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.